Thank you, Kalpana, for those very, very kind words that mean a lot to me. I would like to take this opportunity of saying how privileged I feel to be invited to, release such an important book on cancer. And Vijay and Nilima, of course, I can tell you I related to everything you wrote in that book because I have shared the fear of being diagnosed with cancer when my husband was diagnosed, when my late friend Nilima was diagnosed, and when my mother was diagnosed with breast cancer very recently. So I know that fear of the C word. I've also, shared the uh, the not the real sense of fear and the trauma that one goes through when you actually go through the treatment of cancer. And finally, I've also shared the euphoria when cancer patients go through remission. So I've been through all those emotions. I've shared all those emotions with my very dear friends, my family members, and I know what this whole disease is all about. And I think when I read this book, I realized that this is what every cancer patient has to suffer and endure. It is this fear, this absolute suffering when you go through the whole pain of the treatment process, and then of course the euphoria when you know that you get into remission. Now, having said that, I am also a scientist who believes very strongly that the immune system has a very, very powerful role to play in overcoming cancer. And I know that, when you look at the immune system, it is such a complex system. And we know that cancer is an immune-mediated disease, where because something goes wrong with the immune system, it's about a cell that forgets to die, as you very rightly put it in your book. It is about a cell that forgets to die. And so if you can now teach it to die, and that's the only thing that the immune system has to do, then you actually overcome cancer. Today, if you look at the research that's going on in cancer, it is about really what we call as apoptosis, or the process of cell death. This is what cancer research is all about. How do you get cells that normally go through a life cycle of, living and growing and dying, to actually start going through that cycle properly? That's what cancer research is all about. When you look at things like bone marrow transplant, what are you doing? You're nothing but teaching the system how to get back into apoptosis. So when you actually then take bone marrow stem cells and give it back to these patients, you first have to deplete these patients of their normal, of these cancerous cells, which are not dying. And then when you deplete them and then re-enter them or re-initiate them with stem cells through transplant, you basically then teach the body to really produce those normal cells that go through the normal life cycle process of life, growth, and death. That's what this whole technology and this whole life, is all about. So I think what we're talking about today is really about research that looks at cancer vaccines. You're looking at targeting cancer cells in many, many ways. You're looking at mediating the immune system so that it uses its own bodily, mechanisms and its bodily defense systems to really attack the cancer cells and get rid of them. But having said that, you need a very robust and strong immune system to do that. And it is very well known, and I can vouch for it, that my very dear friend Nilima Roshan, whom all of us know here, was someone who fearlessly fought cancer. She suffered and endured cancer for 6 long years. She never gave up hope. And many times, she basically it was her will and her strong conviction that she could fight cancer that actually got her into remission many, many, many times. It was at the end where really she gave up that fight, and I could immediately see her immune system giving up. I mean, here was this woman who never, never, ever gave up. She kept believing, and she believed in what I used to tell her. I said, Nilima, it's your immune system. Keep strong. Your immune system needs to fight it. And she would believe in that. And she would say, you're right. And every time she felt strong, every time she would say, no, I'm not going to give up. And she would get into remission. So this is about, a fight and getting your immune system to fight the disease. And we know that the immune system is so complex that it is not about just one drug that will help you to overcome cancer. Or it's not just about one treatment that helps you to overcome cancer. So it's not about one chemotherapy, one radiotherapy, one immune therapy. That's not what is going to help you overcome cancer. But we all know that it is a combination of factors where the holistic approach to cancer is a very, very important aspect to overcoming cancer. And, it's something that I'm really looking forward to hearing from Vijay in person, because he very rightly has said that it is this holistic approach. How do you strengthen your immune system? And you can do this in many ways. Why is there a need to do yoga while you're fighting cancer? And I remember my late friend Nilima used to practice yoga very, very diligently. Why do you need other kinds of interventions like Ayurvedic or herbal or anything that boosts your immune system? It's because we want to make sure that we have our natural defenses to help us fight and complement what we are trying to do with allopathic interventions. So I, for one, firmly believe that cancer is a disease that needs multiple ways of dealing with it. So this is what I would like to refer to as holistic treatment of cancer. It's not just about using these kind of interventions, but there is this whole new approach of psycho-oncology where psychologically you have to feel strong, because for the immune system to be strong, psychologically you've got to be very, very strong. So it's a very fascinating field, and I have no doubts about it that not only are we overcoming many types of cancer, today as we know, leukemia, especially infant leukemia and juvenile leukemia, which used to be a fatal disease many years ago, is today a perfectly curable disease. I know many young, children of friends who are completely, have completely overcome leukemia. And yet, 20 years ago, the moment people knew that they had leukemia, the only approach was transfusion, and that had a limited kind of effect on leukemia. So these are the kind of advances that medicine has made. And all I'd like you to think about is, look at the amazing medical advances made just over 100 years in every field of medicine. 100 years ago, there was no insulin, there was no radiotherapy, there was no chemotherapy, there was no modern day medication. Look what has happened over just 100 years. Look at the huge leaps we have taken to cure almost any kind of disease. Today we manage most diseases without fearing them. Cancer is one disease that we still fear. Why? Because there are many, many forms of cancer that we haven't just been able to, deal with in the way we've dealt with other cancers. But I have no doubts about it, that we are going to be able to manage cancers just as effectively as we manage diabetes, and people will not die of cancer. They will die with cancer because we are going to learn how to manage it. It becomes a part of you and you learn how to deal with it. It's never going to kill you, but you need to deal with it. So this is the philosophy and the thinking these days in terms of many types of cancers. And I think I'm very pleased that I'm here this evening to listen to this journey. Vijay and Nilima, thank you so much for calling me today. And I really look forward to hearing your story because I know it must be a very, very difficult story, but then it's also a happy story because it's all about strength, courage, and conviction. So thank you so much.